Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it all to you. Social problems discussed as illness. This is the title of the paper I will discuss today. Very often in the clinic we see patients coming with headache, stomach problems, ill digestion, all kind of poor thriving, depression, anxiety. It looks like a physical or mental disease when you look at it immediately. But when you examine the patient, the disease is not really there. It's obvious that the symptoms are not symptoms of disease, but of poor thriving and social conflicts. If you talk about the work life, or the social life, the family life, or the sex life of the patient, you will very often find 1, 2, 3 or 4 areas which are not working well. And these conflicts are making the patient very tense and taking the patient down. You will see that these conflicts are taking a lot of space in the patient's inner life and consuming a lot of energy and resources. So like tiredness, all kind of exhaustion, like feeling of not having energy to do things, and also on a physical level, are very often caused by these conflicts, which are not solved. So in this case, it's a big mistake to make a physical diagnosis and start treating a physical disease. What you need to do is to explore the social world with the patient, and to help the patient solve the conflicts. It seems pretty obvious, but most doctors are not sufficiently aware of this. Very often these conflicts can be solved quite easily the moment they are addressed clearly. For instance, if there is a problem at work, the patient can shift work to work in another place with something that is more interesting, or with colleagues where the chemistry is better. If there are problems in the family, these problems can be addressed, and the moment they are spoken about, they are already half solved. That also goes for problems in the sex life. The moment you are honest to addressing the problems, you're half the way to a solution. So a lot of symptoms like anxiety, depression, chronic pain can actually be helped. What it takes is a few hours of serious and honest talk. And of course it takes a patient who really wants to work on it. And you will often see a resistance. It's easier to take a painkiller than it is to solve a sexual problem. But the moment you start working on it, it is often so effective and so beneficial that you, after a few hours, will sit with a very grateful patient.